But I think there are people, you're right, in this country that have been trained in other countries that we actually ought to do a hell of a lot better job of saying what do we need to do to, if we need to upskill them or just simply recognize their credentials. I think in some cases we get a bit arrogant about thinking that we are they can't possibly practice. I mean, I look at some physicians, for instance. Are you telling me that somebody who's fully qualified to practice in Australia or New Zealand or Scotland or South Africa or Nigeria, some of these are not qualified to practice here? What is it that makes us so different? So I think we have been a little bit elitist in our country in some cases.
Do you know if the medical associations play a role in terms of obviously it's the colleges of physicians, surgeons that ultimately license these folks, but do the medical associations play a role in potentially creating barriers for immigrant physicians? And I only ask because we've seen across Canada, there's been a push to incorporate other healthcare practitioners to kind of sort of support primary care or, reduce, because there's been a shortage of doctors, just sort of support patients because there's that shortage of doctors. So having more nurse practitioners or other practitioners get involved. And the medical associations have been very upset about that because they're like, well, you just need to, we need to support doctors a little bit more. But then I don't see an effort necessarily, and I don't know if it's the medical associations play a role in this. There are so many trained international doctors who can't get in. So like even if like the certifications don't fully align, like they're still qualified, like they're probably still qualified enough. Like there's got to be some happy medium here to get them in the
Well, I think
system.
this is where the politicians get angry, and rightly so, saying, I don't understand this. We have international IMGs, as they're called, international medical graduates, and you're saying they have to go through this whole barrage of all kinds of training and recertification, etc. Some may be required, but some may not. On scientific evidence may not actually be required, so that we need to be much more flexible and open about stuff like that. I think there's no doubt about it. I think it's primarily the colleges that do the licensing. But if you talk about, for instance, like, well, we need more doctors for primary care and things like that, I actually think, I mean, there's not a place in the world that they don't talk about not enough primary care physicians. Well, it's the medical associations that set the fee schedules. So GPs are routinely classified as, I mean, they're on the lower end of the fee schedules. So you turn around and say, well, I play devil's advocate here. Well, then why don't you change the fee schedule and pay them more if you think it's so important, as opposed to just saying we need more money. Reallocate from some of the higher paying. I know I'll get my head chopped off for that, but look at the reallocation. But I also think, and there's some work being done, I know in the UK, about primary care, unbundling it. What actually is required for primary care? I mean, we've done it in this country where we've equated primary care with an individual access to an individual physician. And people don't think they're getting primary care unless they have their own family physician. I'm not sure that that's necessarily, I'm not saying it may not be, but I'm not sure that's necessarily what you need. You need access to services that are timely and appropriate and all of that. But is it is it a GP? I mean, we have paperwork beyond galore. If actually physicians didn't have to do a lot of the paperwork, maybe they'd have more time to do, the clinical stuff that they're better at. Or you look at communities. I mean, when I was in doing some work in the NWT, I met a physician there who talked about the importance of competencies as opposed to credentials. And he'd done a lot of work with the WHO in Africa. And he was saying, if we rely on credentials for everything, we ain't going to get it. And he used the Northwest Territories as an example. He said, if you talk about mental health and addictions, if we're saying that in order to have comprehensive services, you need psychiatrists you ain't going to get them. We can't get psychiatrists in downtown Toronto, let alone in Tuktoyaktuk. So, what is it that we need to have that provides appropriate services to people? And I think that needs to be. I think that's what primary care, not primary healthcare, primary care needs to look at. And who are the best people to do that? And some would argue they're actually the communities themselves.
Yeah. I mean, sometimes it seems like GPs are just like, sounds not great. So, but almost like really expensive triagers, right? Like, and it's like, is that should that be their main role, or can there be somebody else that can sort of help connect,
Well, I think
people
that's a
to?
good question. Are we doing this? Is what I said about the UK looking at some unbundling of primary care. What is it that they're actually doing, and is there a match between what they're doing and what they're actually skilled and trained to do?
Yeah.
And I think they'd argue that no, there isn't in all cases at all. So
Yeah. Yeah. Uh, from a physician shortage standpoint, though, is there something that you think that we ought to be doing that we're not?
well, there's a lot of work going on. I think one is decluttering the work so that we that any paperwork that's mindless ought to be either eliminated or reallocated. I think this includes I mean we dithered around in this country, as Andre Picard would say, on electronic records. Where the U.S., I mean Singapore, countries like this are way ahead of us.
Okay.
This stuff is so automated now that we've got people. I mean, we actually have some jurisdictions in the country that still use fax machines. Still
Seriously?
use fax to send records.
Yeah.
And so you say, what is that about? So I think there are, obviously we need to look at do we have enough people? But in order to say, do we have enough people, we need to unbundle about what it is what are the skills and competencies they need to do their job, and how are we giving them the supports to do their job, and then
Yeah.
making sure that anything else can be either deleted completely, because some of it's ridiculous, but the other is that it be automated or whatever you need to do.